Hello, this is Marit Kirkevold from Oslo speaking. I'm very happy to address the participants at the Early Leaders Forum, speaking about the Norwegian Teaching Nursing Home Program. And moving to my next slide, this is who I am, and I'm reporting from Norway, in the northern parts of Europe. In my next slide, just to give you a little glimpse of where we are at and how it is like in Norway. And now it's winter time, so snow is heading our way. But I'll move quickly to the next slide, and in this outline slide, this is what I'm going to present to you in the next 20 or so minutes. I'm going to give you just a very brief key statistics about the Norwegian population and healthcare system as the context for the teaching nursing home program that we developed. I'll give you a little bit about the background of the program, describe briefly the developmental phases and results, and then in the last part just briefly mention some current and future challenges that we face in Norway. And then moving to the next slide, just very briefly about the Norwegian population. Norway is a small country. We are about 5.8 million people. About 12.5% is above 65 years. Another 2% about 85 years and older, and we are quite homogeneous, although we have a small indigenous population, Sami people, and we also have about 6% of immigrants. Moving to the next slide, the Norwegian healthcare system is publicly funded system. We have what we call a welfare state. The healthcare system is run by the public and financed by the public. It's organized basically at two levels. So the hospitals, both at the local, the regional, and the national levels, are state-owned, whereas the primary care sector, the healthcare and social services, is the responsibility of the municipalities. All in total, we have about 17.5 thousand hospital beds, and about 1/3 of the patients at any one time are older people, in the sense of between or above 70 years old. At the primary care or municipal level, we have about 200,000 users or recipients at any one time. Moving to the next slide, you can see how the services in the community or primary healthcare sector is distributed. About 60% of the carers or the people receiving care in the communities are receiving care at home, and the rest is receiving care either in institutional nursing home settings or assisted living settings. And this gives you a very, very brief background in terms of the context, the population and healthcare context in which we developed our teaching nursing home program. Moving then to the next slide, why did we establish the teaching nursing homes? Well, that had to do with a long-term set of problems that we were facing in our caring for older people. There was at the time a persistent critique of quality of care in residential aged care facilities. We had major difficulties recruiting qualified staff, particularly nurses, but also physicians and other healthcare professionals. There was a high turnover of staff, and this was also related to the fact that there was little prestige associated with providing care for older people in the community settings. And furthermore, we did not have any formal committed collaboration between the educational institutions responsible for educating future staff, research institutions developing knowledge that could be the basis for improving quality of care, and the elderly care institutions themselves, which had all these problems and were facing the problems and were challenged to find good solutions to these problems. So that was the background for our initiating what we call the Teaching Nursing Homes program. Moving then to the next slide, what we really aimed at was to really try to find a way of contributing to the quality of care of frail older persons. And we did this by trying to improve and secure adequate competence of the staff. So competence development was a major thrust of our program. Furthermore, we wanted to focus positively on the fact that working with older people is really meaningful, is really challenging from the perspective of healthcare professionals. We wanted to improve the prestige associated with working with older people. We saw that creating a culture in the nursing home conducive of development of the services, critically reflecting on the quality, and initiating and supporting research into the care of older persons would be very important in order to support competence development, in order to increase the prestige, and also moving to the next goal, to develop good learning environments for students. So all of these initiatives we believed would work together and hopefully then support the increasing recruitment and retaining of staff, in the sense that people would actually stay put in the sector and new young professionals would want to work in the community care and nursing homes rather than going to the hospitals, which was really the major goal of most nurses and other healthcare professionals at the time. Moving then to the next slide, there is a sort of a quick timeline of the development of the Teaching Nursing Home program. It started out initially in 1996, but even before that we were looking into the Teaching Nursing Home program that was being conducted in the U.S. In the 1980s, and we saw that a lot of the publications about the U.S. programs really showed that this was a very successful program in terms of many of the same goals that we had. However, when we looked into what happened to the U.S. Teaching Nursing Home programs, we saw that they sort of had disappeared more or less by the time we tried to start up. But we learned a lot from that, the U.S. experiences. And then we spent quite some time, 3 years or more than so, in order to very carefully plan the Norwegian Teaching Nursing Home program, and I'll say a little bit more of that later. And then we had a period of 5 years where we had a major sort of project period where we tried to really establish this program, and then the Teaching Nursing Home program went from a project to really being a program that is sort of now incorporated into the Norwegian healthcare system, and I'll say more about that in the future, or in the next slides. The slide Key Events really tells you a little bit more in detail about what I already said, and I don't want necessarily to go through all of these dates. It's just to show you that it took 8 years from the initial idea until the project really got ordinary, what we call ordinary governmental financing. And this 2004 is a key date or a key year for us, because this is when the government really committed to financing and running teaching nursing homes in Norway. And then from 2004 we have had further developments in terms of the number of teaching nursing homes, and the nursing home program has also been initiated actually in the home care sector. So we have teaching home care services as well. And from 2009, we also have centers of care research committed to doing research in this sector. And we are now heading for the next years trying to develop new plans for the teaching nursing homes and home care services. So in the next slide I'm just going to give you very briefly some results from the project period as well as the next years. So starting with phase 1 to 3, which was the establishing project period, both the internal as well as the external evaluation processes indicated that in fact the teaching nursing homes were able to contribute to increasing the competence of staff. And this was done both formally by having more people getting degrees at different levels, but also there was a lot of competence development going on informally in the teaching nursing homes, so that people when being asked felt that they had more competence to really address the complex needs of patients, and they felt more prepared to deal with the challenges. And the nursing home sector also had more people with degrees in nursing and so on. We also saw that the locally initiated quality improvement projects that were launched and that were really based on bottom-up decisions about areas where the staff, leaders and so on agreed that they needed to work, really led to better quality. So that the quality, we didn't measure quality across the teaching nursing homes to see if they improved generally in quality, but we really evaluated the teaching nursing homes in terms of what they had said they wanted to improve on in terms of quality. And we saw that they had been able to succeed in improving care, for example, in terms of nutrition, palliative care, care for persons with dementia, rehabilitations and so on. We also were able to develop models of competence development that other nursing homes, not teaching nursing homes, could use in their own institutions. So that not only did we improve competence development in the teaching nursing homes themselves, but we also were able to share the experiences and the models with other interested institutions, which is very important to improve the sector as such. We saw that the systematic working in terms of really improving the learning conditions for students were very important. Initially, before the teaching nursing home project was initiated, students, for example, in nursing didn't want to go to teaching nursing or to nursing homes at all because they didn't feel that they really learned anything at all. Whereas during the teaching nursing home project, we really were able to show students that caring for older people in nursing homes is a very challenging, very exciting, very meaningful way of providing care, and that it's really necessary for nurses and other professionals to be very well prepared in order to take up a position in this sector. And we saw that this was much more demanding for the students than before, but it was also much more inspiring, so to speak, in terms of really considering to take up a position in this sector. And we saw that very gradually the work actually being working in the teaching nursing homes were much more enthusiastic about working in this sector. They felt that what they did really mattered. They felt that when they were allowed to really work systematically to improve their care, to improve their competence, it really made a difference. So although the results in terms of recruitment and retention of staff was sort of mixed, what we found was that staff in the teaching nursing homes were much more, could easily move about because they had new skills and they were able to move. But we also saw that the retention in some ways we were not successful in terms of, because when people got more competence, they were also much more critical in terms of, are we able to really provide the care that we want to do? And if they were not able to do so, they would also move on. So we had to really work very hard to keep people in more qualifications. Anyway, summing up the evaluation phase, it was concluded by the Directorate of Health and Social Services, the government, that the teaching nursing home project had been successful in providing or meeting the goals that we had put up, and they decided that they wanted to support a formal and permanent establishment of these kind of institutions. And this was done in 2004. And the teaching nursing homes, as well as the teaching home care and so on, is now on the national budget. So every year there is a specific number of million Norwegian crowns going to these institutions. Moving on to the next slide, there has been follow-up evaluations from 2004 and up to 2009. And what we see is that even when the institutions was established permanently, they have continued to improve both the competence and quality of care in their own institutions, but have also been able to work together with collaborating nursing homes in their own regions. And we have seen that there has been a large number of local projects addressing local issues and problems. So the government decided to continue the bottom-up kind of quality improvement initiatives that had been initiated previously. And there is a remaining enthusiasm, high enthusiasm about the teaching nursing home concept. That is to say that it is still highly competitive to try to become teaching nursing homes, being nursing home partners, being part of this family of institutions that is working very systematically to improve competence, quality, and so on. The next slide also shows that during the last 4 or 5 years, the government, the Directorate of Health and Social Services, have really seen the teaching nursing homes as very active partners in terms of realizing central government initiatives. So not only do they support the local initiatives, which really come from the staff and local leaders, they also use the teaching nursing homes as vehicles in order to sort of move in the front in terms of realizing quality improvement initiatives. And for example, we now have governmental policies like the palliative care plan, improving the dementia care plan, improving the competence improvement, and so on. And the teaching nursing homes are really key vehicles for the government to realize these policies. And as I mentioned already, the same kind of model, the teaching nursing home model, is now adjusted to also be included in the social service, which is at the municipal level, and the home care sector, which is also at the municipal level, but these new initiatives were really governmental. So whereas the first teaching nursing home project was really developed locally, and we sought support, financial support from the government now is sort of the leader in terms of developing this concept further. And furthermore, during the last 5 years, the teaching nursing homes are becoming more and more attractive also as research partners, so that universities, researchers are contacting the teaching nursing homes to carry on research in terms of elderly care at different levels. I'm moving on then to the next slide, just to give you a few examples of how in this phase the teaching nursing homes are contributing to realizing national governmental initiatives. I mentioned the Dementia Plan 2015, which is a very comprehensive 8-year program to improve the treatment, care and quality of life of persons with dementia and their families. And it has a lot of different policy aspects to it, including improving the housing, developing new services, improving the qualifications of staff, as well as really the structural administrative systems that can really make sure that the quality is at the level that the government wants it to be. And the interesting issue in this case is that 3 of the teaching nursing homes in Norway were then got a special responsibility and was appointed so-called dementia lighthouses. And they are supposed to really be in the forefront in terms of developing care to dementia patients in the kind of issues that they were asked to do. So that in Oslo, for example, the teaching nursing home has a specific task of developing knowledge in terms of milieu therapy. And they have launched several different research, competence development and so on projects, looking at non-medical initiatives, treatments, and so on, in order to really create good environments for people with dementia. The teaching nursing home in the southern parts of Norway, Agder, got the responsibility to develop initiatives to support family, to diagnose dementia, to specifically look at their programs, and also how to use individual care plans to really coordinate the care to individual persons with dementia. Whereas in the northern part, in Tromsø, the teaching nursing home was asked to develop models specifically looking at ways of improving the competence training of all groups or all levels of staff. So that in this way, each of these 3 nursing homes will develop knowledge, models, experiences in different areas that can then be used by the government to disseminate these experiences to the rest of the sector in Norway. Moving on to a different way of realizing national governmental initiatives, this is just to show how one of the teaching nursing homes in Bergen really worked together on a very specific but highly challenging task, which is really to improve the care of teeth in the nursing home population. We have major problems in terms of people having problems with their teeth, and this is really a problem in terms of nutrition, in terms of infections, and so on and so forth. And they have been they developed a project locally, and it's now all over Norway as a part of a national guideline kind of thing. Similarly, the teaching nursing homes have initiated and taken a responsibility in terms of improving qualitative or palliative or end of care life. They have tried to develop models in terms of really creating meaningful activities in daily life for older people. They have looked at ethical issues of autonomy and participation in among patients living in or residents living in nursing homes, and so on and so forth. So I'm then moving on to a summary. And this slide really is trying to look at or very pinpoint what kind of strategies did we use to try to establish and teaching nursing home model, the collaboration between nursing homes or community care, the research sector and the educational institutions. First of all, we really, as I've tried to show, really put we stressed using political strategies, having the key actors involved from the early start in order to really get commitment to this program. And I think that has been very important, and it has made the government, both at the local and the regional and the national level, committed to this model. We have used different ways of structural institutional strategies to try to really commit collaboration both from the clinical or municipal sector, the teaching nursing homes, as well as the education and research settings or sectors. And we have tried to develop positions where people would be part-time at the teaching nursing home and part-time in the nursing school or other educational setting, part-time in the teaching nursing home, part-time researchers and so on, in trying to really work together across these sectors. A major thrust of the Norwegian teaching nursing home program is really culture building. We have tried to develop what we can call learning institutions in these, both in nursing homes as well as in the educational and research institutions that have been involved in this, trying to continuously work together, clinicians, teachers, researchers, leaders, to carry out local projects and really stimulate the critical reflection of how can things be done differently. And the project-based initiatives, the local projects, have really been what has contributed mostly to the enthusiasm among the staff. So that the locally based project has been very important to gain the support from the staff in the nursing homes. And finally, using clinical guidelines and combining education, competence development, and practical organizations to try to show that research-based guidelines can really work in this sector has been very effective, and has also really inspired students to want to go into this sector, both as students and when they have finished their schooling and training. Moving on then to the final section, the future challenges. During the last 15 years when this project has been going on, there has been major critique of the Norwegian healthcare system, particularly when it comes to collaboration between the hospital sector, which as I mentioned initially, and the municipal primary care sector. So there is now currently a major system reform initiated, which we call a cooperation reform. And it really is developed to address three failures. What has been called a system failure, where we do not have a comprehensive service that works seamlessly between hospital and community care. There is a capacity failure in terms of that the number and needs of patients increasing, and particularly older people, is increasing markedly, and we do not have the capacity at this point to really address those needs. And we have to prepare for the future in terms of the big population with persons with dementia and so on. And then the third failure that we see in Norway is that we are much better at treating health problems than trying to prevent them. And particularly when it comes to aging and when it comes to chronic illnesses and so on, early intervention and prevention, primary, secondary and third prevention is very important, and we don't do that very well. So that we need to address these challenges much better in the future. So the conclusion then is that the Norwegian Teaching Nursing Home Program is becoming a significant partner in terms of improving the quality of care. They are seen as a significant vehicle for implementing national and local policy initiatives. They are used as to develop similar models in home care and social services, and they do generate substantial enthusiasm in terms of working in this sector. And thank you very much for letting me speak to you, and I wish you all luck with your further program. Thank you very much.